Yeah.
Hey, my name is Ariadne Chong, and this is a journey towards acne-free skin. Like you too, imagine this. You've applied to your dream job, and they've called you because they want to interview you first thing in the morning. And of course you say yes. So you start preparing your clothes, you start thinking of the first impression, what they might ask you, and how you might respond. You're excited but also nervous, but despite being so anxious, you manage to go to sleep early. And when you wake up in the morning, you make your way to the bathroom and you're surprised that a giant zit that sits in the middle of your forehead catches your eye. And you say, of course this would happen to me, of all days. So today I'm going to share some information on what acne is. I've done research for a couple of weeks on this topic, and I've also suffered with acne for about 15 years. According to clevelandclinic.org, approximately 80% of people between ages 11 through 30 suffer with acne, and most of these people suffer with acne at some point in their lives. So this means that even if you yourself have never had an outbreak in your entire life, you know someone who has. So today I'll be informing you on what acne is, what causes it, and how you can treat it. But first, let's get into what acne is. So a newspaper article by Dr. Miriam Stoppard in the Daily Mirror defines acne as a common skin condition that causes lesions or spots to develop on the skin. It's a blockage of oil and dirt and debris, and it's caused by an overproduction of oil in the hair follicle by the sebaceous glands. Now there's different kinds of acne and a range of severity, and these include blackheads, whiteheads, pustules, cysts, and nodules. Now you can take a look at the pictures in the following slide, and you can see examples of the ones I've just mentioned. And you can also see how each type of acne develops on the surface of the skin. So now that I've explained what acne is, let's discuss what causes acne. So the main thing that causes acne is fluctuation in hormones, specifically testosterone. So Dr. Stoppard says that commonly acne is linked to a rise in testosterone in teens, which causes more oil to be produced. This thickens the inner lining of the hair follicle. Prudence Wade wrote an article in the Gloucestershire Echo where she interviewed Dr. Adebity, and she urges us to take a look at our diet. Now she stresses the fact that we should stay away from processed foods and focus more on whole foods. This is because sugar makes our insulin rise, and that spike in insulin causes that spike in insulin causes cortisol levels to rise. And cortisol is a stress hormone. Some other triggers could be oil in personal care products like your makeup, your lotions, your moisturizers. Now, medications can also cause acne, and genetics can leave you predisposed to developing acne. These are some things that you should stay away from. Now there's many ways, now that I have talked about what causes acne, let's talk about how you can treat acne. There's many ways to approach treatment. There's options that are almost innumerable. There's topical medications like benzoyl peroxide, salicylic acid. There's also oral medications that you can take like antibiotics and birth control. Birth control, what it does is it regulates that fluctuation in hormones in women. Now, isotretinoin is for severe cases, and according to Dr. Lung's book titled Acne, he warns that isotretinoin should only be used in the most severe cases because of the severe side effects that come along with it. Now, you can incorporate some lifestyle changes like avoiding sugars and carbs. You can wash your face daily. You can also make sure you get enough sleep, because when you sleep, your skin regenerates. So that concludes my discussion on acne. So let's review what we've talked about so far. Acne is a problem that many of us have dealt with in the past, but there's hope if you're still fighting this battle with acne. There's so much you can still try, It's just a matter of finding the right combination of medications that's right for your skin. So we know that acne is a blockage in your pores that can bring on infection in the hair follicle. It's caused by too much oil production. We also know that we need to find out what causes or triggers our acne. Once we know what it is that causes and triggers our acne, we can know how to better approach our treatment options. We know that there are so many options available to us. It's just a matter of finding the right combination. 85% of people suffer with acne, and hopefully the research and the experience that I've acquired will help you to show up to your dream job interview with one less thing to worry about. The last thing you should worry about on important days is the condition of your skin. And I always say it's better to prevent a breakout than to try to wish it away. And if you have any more concerns or you need more information, these are my resources. And I'd just like to thank you for taking the time to listen to me. Thank you.